So what are the most important things to do if you've got COPD? What are the really important messages? So I guess the first thing is that if you smoke, quitting smoking is the most effective treatment for COPD to improve your symptoms and stop your condition getting worse. Even an occasional cigarette can inflame your airways, so it's important to stop completely. You should get a flu jab every year. This protects you from the serious complications of the flu. Pulmonary rehabilitation is one of the most effective treatments for COPD. If you don't know about this or have not been offered the chance to take part in pulmonary rehabilitation, you should ask your healthcare provider, your respiratory nurse or GP. It's important to keep as active as possible with COPD. People avoid breathlessness. That's because breathlessness is unpleasant. But if you stop doing things, you become less fit, and if you get less fit, you become more breathless and get breathless more easily. So there's a sort of vicious cycle. So a really important message is that making yourself breathless isn't harmful in itself, and it's important to keep sort of pushing the limits and deliberately keeping active. If you're on inhalers for your COPD, it's really important to make sure that you know how to use them properly. If you're not sure, ask your healthcare professional about them. You can find some useful inhaler technique videos online. One really good place is www.rightbreathe.com. You need to make sure that you know what to do if you get a flare-up or an exacerbation of COPD. And also, if you are someone who produces sputum and having difficulty bringing up sputum off your chest, ask about chest physiotherapy and whether that's something that might be helpful for you. And finally, the British Lung Foundation is a really good source of information for people with lung disease, including COPD, and is a really good source for help and advice, and also runs sort of support groups for patients and families and carers who've got lung disease called Breathe Easy groups. So it's worth finding out about those, and again, ask your respiratory nurse or GP about that, and they may be able to advise you, or just search online for Breathe Easy British Lung Foundation.